As you know, we have so many interventions which are quite expensive and unnecessary and do not provide the same benefit. Whereas pulmonary rehab is the most evidence-based, and it's done, the trials are done on almost thousands of patients, and it's known to kind of reduce the breathlessness and all the symptom load and the symptom burden. And that is why it's quite essential for GPs to refer. And most of the time it is about explaining what it involves and to get the patients engaged. It also reduces the frequency of exacerbations and the need to get admitted to hospital. And even if they were to get admitted, the duration is quite shorter.
I would say as a GP, it's very important for me to explain to patients what PR is and the importance of it. But I think we've got sometimes a limited time to explain that to them. And it's all about making sure that every opportunity counts, every time a patient comes, talk about it. But it's the ways on how to talk about it, because once we to say to patients it's an exercise or pulmonary rehab, the big words makes them a bit, oh, I'm breathless like this. If they're going to put me in exercise, it's going to be very difficult for me. And that might put even a patient who are referred off going to PR.
People who should engage in PR is anybody that has COPD confirmed by spirometry and wants to improve their health. They want to improve their condition, they want to improve their quality of life. They just need to want to engage and be receptive to what they can learn from us. They can walk with a stick, they can be in a wheelchair, they can get breathless just after a few minutes. We can still help them. To refer a patient to pulmonary rehabilitation, GPs can refer by the e-referral system on the GP gateway. The patient just needs to have confirmed airway obstruction on a spirometry, and they need to supply that spirometry to pulmonary rehabilitation. And they can also use that gateway to refer patients to the community COPD service as well. Because if they're thinking that they need pulmonary rehabilitation, maybe they need a specialist service also. At pulmonary rehabilitation, patients will not only be able to engage in exercise, which will be at their level, and they won't be pushed into doing anything that they're not comfortable doing, but also they will receive education on managing their symptoms, improving their health, self-managing when they're unwell, how to stay fit, stay healthy, eat well, keep warm. There's lots of education and exercise that pulmonary rehabilitation can advise and support patients on.
It has changed my life more than I can ever explain. Physically at home, I can do more things now than I thought I ever would again. Pulmonary rehab has made most days better than I could ever have imagined they would be.